Hi, I'm Dr. Issam Khayata, MD. I'm a pain specialist practicing in Virginia. I have been working in pain medicine for over 15 years, initially at the academic center at the University of Massachusetts. And I focus on evidence-based medicine, but I also look at the science and alternative medicine literature. And I'm often open to new and innovative therapies, and that's why it got me interested in chronic disease prevention management programs. So what's my interest in this field is, as we know, chronic pain is a complicated condition to treat. There are several dimensions to chronic pain that affects the intensity and severity and how we cope with it. There is the structural anatomical part of the pain, whether it's originating from bone, joints, muscles, nerve, ligaments, or other tissues. But there's also the mental components, is how it affects our ability to process and decision making and our thought process. But there's also the emotional components, how it affects our mood, perception, interacting with others. So all these things comes into the chronic pain when it's been there for a long period of time. Modern medicine made it a greater progress in understanding and treating pain for the last 20 or 30 years. We've made a great progress, but still there is the gap is not filled. There's a lot of areas that we don't have a very full understanding of how the pain is processed and modulated in our body, as well as the chronic diseases as well. We focus our efforts on doing the pain medication, the injection therapy. Sometimes we recommend surgeries, but we focus less on the emotional and mental component of the pain. We also limit ourselves sometimes to the mainstream medicine, but alternative modalities such as acupuncture, yoga, relaxation techniques, they also proven themselves to be helpful in some patients, even when the evidence is not very strong or suggestive, but clinically those modalities help patients and we often recommend it to them. So chronic disease management centers focus on a new treatment modalities with focus on oxidative state of the body, addresses pain and chronic diseases, more at the cellular level, looking for biomarkers, any imbalance in the hormonal essential elements, inflammatory markers, mediators that could be responsible for chronic condition, as well as some of the immune modulators that can also help in readjust and reestablish the balance in the body. Um, it offers the opportunity to intervene early in the disease process before the condition becomes chronic. Um, but even after the condition becomes chronic, it helps managing this condition so it does not advance to become much more harder to treat condition. In the US, we've done a great job in treating acute emergency conditions such as heart attacks, strokes, accidents, but we're lagging behind when it comes to chronic managing chronic diseases such as diabetes, obesity, degenerative disease, and cancer. So, what are chronic disease prevention and management centers? These centers are focused on reestablishing the homeostasis of the body by identifying the imbalance or disruption in the homeostasis. Modern medicine, we treat diseases once they're clearly evident by sometimes um, start before specific signs and symptoms of imbalance before we're able to detect them by doing certain blood works or imaging or tests. But there are certain biomarkers that appear early in the disease that can be detected, um, such as cancer, autoimmune degenerative disease. They start years before they are diagnosed. These diseases are leading cause of death and disability worldwide, and they also leading drive of higher healthcare costs. At the CDPMC centers, we focus on early detection and treatment of any chronic diseases to avoid getting into chronic disease state and much costly um, treatment modalities. Additionally, chronic disease management focuses on stress reduction and immunity modulation therapies. The need of these became so evident during the 2020 pandemic, um, when higher people were exposed to depression and emotional difficulties, which leads to um, affecting people's immunity and ability to fight this deadly disease. So, what therapies are offered at the chronic disease management centers? At the chronic disease management centers, our job is to make it easier for all patients to make healthy choices so they can enjoy life. We start with simple methods such as nutrition. We look at the evidence very carefully to recommend the best nutrition and supplements to the patient. We also focus on eliminating bad habits such as tobacco smoking or tobacco use, excessive drinking, and replacing it with a better habits such as exercise, stress reduction, relaxation techniques. Again, we formulate a program that the best has the best chance for compliance from the patient and based on objective testing and biomarker levels. What other therapies are offered at the CDPMCS? We offer state-of-the-art, cutting-edge, evidence-based medicine, which includes, but not limited to, photoreductive therapy, photodynamic therapy, nanomedicine, radiofrequency ablation, and nitroredox medicine. These techniques are emerging and proving efficacy against chronic autoimmune and degenerative disease, which manifest themselves as chronic pain and chronic disease state. What else is offered at your center? We also offer wellness, anti-aging, aesthetic services. When the chronic disease are well under control and the patient are fully in compliance with treatment regimens, we believe they deserve to reward themselves by looking good and feeling good about themselves. And we help them in that regard through science-based regenerative and functional medicine therapies that we offer at our centers. What are my final thoughts? My final thoughts about the CDPMC as we are a group of physician and healthcare professional network that we meet regularly and work together to look at the new treatment modalities and examine the evidence. We look at the science, we exchange experience, and implement therapies that helps our patients worldwide. We take pride in providing our patient with the highest quality individual and patient-centered care and health education treatments. Come in for consultation and comprehensive checkup at one of our CDPMC centers and check things for yourself real